Hello, good afternoon, good morning, good night, wherever you are. I think we have a very international audience thanks to the fantastic international reach of the e-Governance Academy. My name is Paul Timmers and I will be the moderator for this session on trust in vaccine certificates, where we will, I think, pick up actually where the previous panel left, because they ended talking about trust and communication. And we will certainly talk a lot about trust and vaccine certificates against the backdrop of some of the developments in Europe, in particular that at the European level, the European Commission has proposed a digital green certificate. But we are also very interested to discuss what is happening at the national level and internationally, like what is happening in the context of the World Health Organization. I'm pleased that we have a fantastic panel here. That can walk us through some of the issues that have to do with vaccine certificates and trust. And in the panel, we have a representative of the department in the European Commission, DG SANTE, that is heavily involved in developing the digital green certificate. That is Konstantin Hyppönen. He's a policy officer at the European Commission. He's got a computer science PhD and has been the lead architect in Social Insurance Institute of Finland. We will then, after he has given a presentation, get a short presentation by Aaviksoo. Ein is the Chief Medical Officer of Guardtime, a lecturer at Tallinn University in Estonia, and has a master's in public health from Harvard, and is also a medical doctor, like others we have had before in this event. And then finally, we will have an explanation by someone who's very much involved in this trust framework that has been mentioned before, the trust framework which is linked to the European proposal. That's Vincent van Pelt, a medical doctor and a software engineer, and senior advisor to Nictiz, which is the Dutch organization for digital information exchange in the field of health. So we'll have three speakers. Your moderator himself is associated to the University of Oxford, of course, moderating here in a personal capacity, and also professor at the European University in Cyprus. And I've been a former director at the European Commission and advisor on digital health and European health data space that was interestingly mentioned at the end of last session to the European Commission. Now, we have quite a challenging topic in front of us. And what is also quite interesting is that we kind of see here live policy making that has to happen in a situation of extreme pressure and very high expectations. So you cannot expect that all answers are known at this stage, but we will try to get a bit deeper, in particular about trust in vaccine certificates. Now, we will have these presentations, and then there's the opportunity also to discuss with our panelists and also from your side as participants listening in to raise questions. And if you are on the workshop side, you will see a Q&A button that you can use to enter your questions, and hopefully then they will ultimately be passing on here. So now I would like to give the floor to Konstantin Hyppönen for your 7-8 minutes presentation. Konstantin, over to you.
Thank you very much, Paul, and good afternoon, everyone. It's afternoon, at least here in Brussels. So happy to be here, and many thanks for inviting. I'll share my screen so you could see a few slides. I will present shortly this proposal of the regulation on digital green certificates and also the proposed technical architecture for the design of this solution. So the status quo in Europe is that we have COVID virus pretty much everywhere. A few countries are still green, Iceland and a part of Norway, and that is why member states have established a number of different restrictions requiring different types of medical certificates, test results, and so on, in order to prevent the further spread of the virus and its variants. However, there is no common approach to this, and what we also learned from, for example, representatives of travel industry is that, well, there could be, for example, 10 countries in the world which require or supports the provision of vaccination certificates instead of, test results, for example, or being quarantined, but only 2 countries would use the same rules. So there is discrepancy in the approaches, and also we see that these restrictions imposed by member states, they are not fully in line with the basic free movement requirements. So there are a bit too much of the free movement restrictions. So and also one of the problem is that when citizens are providing these certificates, sometimes they are rejected, and this is of course not a nice surprise for the citizens. So what we see is that certificates are pretty much different, issued by different member states, and yeah, with 27 member states, we could see 27 types of certificates, different data fields, verification and authentication mechanisms, and so on. So we saw in the news also that some citizens were rejected, entry into member states because they could not provide a certificate in a suitable language, for example, while boarding the plane. So this is really not acceptable. That's why there is this proposal for the digital green certificate regulation, and its main principle and goal is to facilitate free movement in the European Union. It doesn't mean that vaccination will become mandatory or be a prerequisite for such free movements. That is not the case. And also discrimination of people, that is not the goal, and that is not the case here. Non-discrimination is of utmost importance. And that is why not only vaccination certificates, but also test results and certificates of recovery are here in the scheme. And of course, the fundamental rights of data protection will be fully ensured as well. So the outline of this regulation is that, first of all, it's based on Article 21 of the treatment of the functioning of the European Union, that is free movement of EU citizens, and that means that the use of such certificates, for example, for continuity of care or for some private use, which could be envisaged by some member states, this is out of scope of the regulation. So the objective is to facilitate free movement, and a digital green certificate is the tool for that. And what is meant by digital green certificate? It's one of the 3 certificates. It's either a vaccination certificate or a test certificate or a certificate of recovery. It could look, for example, like this in its digital version. It has a QR code, including the relevant minimum data. Only key information is included. And every citizen who receives vaccination is entitled to receive a certificate for that vaccination. And the same basically applies to tests and recovery certificates. And the basic idea here is that this is not a new restriction to be imposed. That is totally not the case. It's about accepting certificates issued by other member states in case some certificates are required at the border. So if a member state waives free movement restrictions for vaccinated persons, for example, it is obliged to accept vaccination certificates issued by other member states. And according to the proposal, that must be also for EMA vaccines only. But the basic principle is that where member states accept their nationally issued certificates, in the same way they must accept also certificates issued by other member states. Who is covered by the proposal? It's EU citizens and their family members, and also the incorporation into the EEA agreement, EEA nationals. There is also a way to support free movement with Switzerland, but that depends on a Commission decision and reciprocity. So it depends also on Swiss approach to this. And in addition, there is one more regulation proposed. That's kind of a twin regulation, the conditions under which nationals of third countries shall have the freedom to travel within the Union for a short period if they have the right to reside for this short period. The outline is such that there is, of course, a country of issuance, and the data which is used for generating the health certificates is there. So a digital certificate is generated by country A, and it's digitally signed using a private key. And then the public key corresponding to that private key is sent to the centralized infrastructure, the gateway. So it's important to note that this gateway does not contain any personally identifiable information. It's only for sharing some basic information required by the trust framework, such as the public keys linked to those signature certificates, private keys used for signing digital green certificates. Then this information, which is not containing any personal details, is fetched from time to time by all countries of verification, and that information is used for checking the validity of the certificates when they are presented by their holders.
Konstantin, one more minute, okay?
Yeah, I'm almost finished. So we are not building this on top of nothing. We have already guidelines. We have adopted the guidelines for the data sets and also this outline of the trust framework, the picture which I was showing you before. It's also an adopted e-health network guideline document. And also the Health Security Committee has adopted the data set for test certificates. We are doing collaboration with other international organizations. WHO is present in this meeting, and we are happy to see that what we offer to WHO, they are considering it, and we are able to support their work. And we are also with very much interest follow their work and analyzing its results. But also we are in dialogue with ICAO because these certificates are likely to be read by, for example, airlines, and we want to ensure that it's easy to do. The last point which I would like to make is that this regulation, it has a sunset clause. So when the pandemic is over, the regulation will, its application will cease. And the question is, do we build all this stuff just in vain? No. Because when countries are preparing for this deployment of the digital green certificates, they are at the same time building infrastructure which could be reused for some other purposes, and at least two purposes are very clear. One of them is My Health at EU, so enabling health professionals to access data of foreign patients in their own language. In patient summary, in that infrastructure, there is also vaccination data and diagnosis data, etc. So it's more stable and sustainable solution for the longer run. And also the second point is the EU vaccination card. There is no decision yet to make one, but the feasibility study is ongoing, and any inputs which would be produced by member states when they are preparing for digital green certificates would be also useful for building a possible EU vaccination card. With that, I thank you and close. Over to you, Paul.
Thank you very much, Konstantin, for this very clear and important presentation. And although this is an EU initiative, I think it has very much international relevance, not only because of the international connection, but also the principles, the free movement, the types of data and certificates that are captured, the interoperability. But if in our international audience you would have specific questions how this might connect to what you are doing outside the European Union, please do post those questions in the Q&A. Happy to take them up with the panel. So now we will move to Aaviksoo for his view and his take on this. And knowing that you are very practically involved in this too, keen to hear your presentation for about 7 minutes. Over to you.
So it is good to follow from what Konstantin has just laid out. And I will bring a different view. Indeed, being a chief medical officer at one of the companies who is developing such smart vaccination certificates, and having been involved in the collaboration with the WHO even before the COVID era, I am wearing today 2 hats. So I'm talking from a tech company point of view, but I still in my heart am a medical professional and also a public health person. So I think that it's honest to start from laying out. So what has been my personal and also the Guardtime's approach to this from the very start. So it has been really as a response to the COVID pandemic, rather than working on a document that would enable people to travel. Because I believe, and this is also what Guardtime has been working in other domains, is that the trust is very difficult to create in certain point. It has been already emphasized a few times. It is really a process and the governance, how those processes are managed, that in the end of the day make people to trust. So that when we talk about vaccinations and vaccination certificates, understanding that not only is important that the document is secure and immutable and everything, it is also important that the fact of vaccination did happen with authentic vaccine, and so coordination of the vaccine distribution of authentic vaccines, giving real-time situational awareness and collaboration between the different stakeholders. And if from that process, either for the first instance, because we know that with COVID, many vaccines require several vaccinations. It may be that another vaccination will take place in another location. So there are already, you can start evolving use cases which actually go beyond this just travel use case. And I think that the main question really is to still always, if people get into very technical discussions, be them IT technology or healthcare technology, is remind each other what is the why, and that helps to find a good answer to how we address this. And I have been in those discussions, and I remember the first reason to have smart vaccination certificate was to empower citizens and continuity of care, either because you need this vaccination in another location, or now we know that there might be probably revaccination need. So this was the starting point. And then, of course, there is a need to, or you could make the case that you need to verify your status. WHO has been very clear saying that you can't verify immune status. What you can verify is potentially a fact that you have been vaccinated. And then you already get into the domain, are all vaccines the same, and that. And even more, I think that the public health monitoring and surveillance, which has been omitted, for practical purposes, I still believe personally that there is a value in it. And so all these use cases, as you can see, they have slightly different kind of benefit package, if you will. And also, if you think from the citizen's point of view, to share my health record with another healthcare professional, that's a very different situation than I'm about to share it with a random bodyguard. Well, the data content, again, is kind of in a different manner tilted, which means that I'm much more open to share much broader set of data with another healthcare professional, whereas on the border, the bodyguard really needs, perhaps, if at all, to know yes or no. So I think that this discussion has become a little bit too technical, or at least I know it has to be technical in order to be practical. But sometimes we need to understand, okay, we are dealing with some specific problem, and we should have maybe perspective to take also the other issues on table, but at least that we don't fight without clear kind of agreement. So this is a slide that I've showed a few times. This is something which tries to combine what the WHO, what the European Commission are trying to do, and then on the bottom there is something that companies like Guardtime is trying to do, which is to provide some specific solution for a smart vaccination certificate. And I will finish by saying that our approach always has been to try to enable and focus vaccination campaigns effective by enabling different stakeholders to collaborate. And that is why we are working in order to increase the reliability of distribution chain. But that is then the end result, or okay, that's the beginning, and the end result would be then the smart vaccination certificate. And all in all, it somehow has to be part of the vaccination campaign management that all the governments are so worried about. So thank you for listening up. I hope we have a good discussion. And really, I hope that in the end of the day, what we are doing is building a service for the citizens that would empower them and would make them really in better control of the data in various situations, because that is how I understand smart. Thank you.
Thank you very much. Great slides, and also thank you very much for breaking the theme of collaboration between the various parties that are involved. And if time permits, I will come back to that, because this is certainly not something that is just one party and government top down, as the whole crisis has been something to manage also in partnership with many parties. Not simple to do, and certainly not simple to do in a situation of stress and uncertainty. So I'll come back to that. So thank you, Ein. We'll now go to our final third presenter, Vincent van Pelt. And I'm very keen to hear from Vincent more also about the trust framework and his experience from the Netherlands, but also participating in European collaboration. So Vincent, the floor is yours.
Thank you, Paul. Thank you, everybody, for inviting us. I will share my screen. Start. Right. Hopefully you can see my screen now.
Yeah, it's okay.
And I will put it in the presentation mode. Okay. What that works is, yeah. Okay. Yes. Well, thank you. We are, as the EOS Network subgroup on technical interoperability, working friendly and frantically on, well, getting this done, so to speak. So putting it all together is what I call it. And what we are putting together is all the different technical aspects that can help us in creating something that is safe, preserves privacy, prevents fraud, and is acceptable by everybody, because of course we take into account all the ethical, the societal, and the practical and the legal aspects of this certificate. And of course we try to create something that is that is born from a transparent process that uses the best experts in the world, and in that we also work together with the WHO and with ECDC and the HSC and other organizations who can help us to create in collaboration with each other this trust framework, so that well, everybody will be able to use the same foundation for trust, and the same way of working that was already shown by Konstantin will allow certificates from other countries to be accepted in our country. And that is a little bit of an introduction. And let's first look at what the certificate will look like as far as we have thought of at this point in time. Actually, the information that is in the paper or in the digital version is the same. And both also contain a QR code. And that QR code is like a sealed bit of information that tells you who this certificate is for, who has issued the certificate, so who is the responsible party, and the minimum information that you will also see on screen here. So the written form is also in the digital form. That's basically the idea. Well, what we would like to do is to make the QR code in such a way that it is checkable whether it's valid. And the validity, normally you would check a public key by going to a European website and getting that information. But we have also decided that working offline is the best way to prevent any traffic that could relate to personal and private information as much as possible. Basically, this is another view of what has already been shown by Konstantin. So at the issuing side, you have either a vaccination or a negative test or a recovery from an infection. And each of those are valid for access to another country in the EU. There's a link to the holder, so because you have to be able to verify that the person who's showing you the certificate is who he says he is, so it is being identified. He is being identified at the issuing side, and in the QR code there's also a PKI, a private key for the responsible party. So at the verifying side, there are some questions that need to be answered. The border patrol person does not have to see any details because he's also in a workflow. He has to check the passport, and then he's also check the certificate, and he is not really interested in all the medical details. What he is interested in, or she of course, is this certificate linked to the holder? So that's something that you can check. Is the issuer sealed? Is the issuer trustworthy? And is the person okay for travel? And okay for travel means either vaccination or negative test or recovery. So actually, you don't have to know whether a person has been vaccinated or has had a negative test or has a recovery certificate. So that also detaches the actual medical data from the border patrol control. In the bottom, you will see that the public keys are sent to a national private key directory. Those are uploaded to an EU level private key directory, which is, by the way, also linked to a global PKD, for instance, by the WHO. And then the software that checks whether a person can pass uploads daily this list, EU PKD, which is simply a list of keys. And that's refreshed every day so that when some issuer is not trusted anymore, he will not be on the list. And so then that would stop the person from passing if the PKI is not in the list. So I hope this is enough information for how it works and what is in the certificate. I think this is an example because we started with the vaccination and now we've also added negative testing and recovery. But as an example, this is how the workflow would go. The citizen is identified by the vaccine provider. So he has to show who he is. Then the citizen is vaccinated. The information is registered usually in an immunization information system, and then the citizen can, at the same time or later, request a certificate when he wanted to travel. Then the certificate issuer sends a vaccination certificate, either paper or digital or both. And then whenever the need arises for travel, the citizen can show the certificate, and then the verifier checks whether the certificate is valid and whether the person who shows the certificate is the person who he says he is. So that's probably how it works. And well, coming back to the different things that we have taken into account, I think what we have now is the realization of many different countries that if we work together in providing a very solid trust framework, that everybody can use that framework and benefit from it, and allow their citizens to at least give the opportunity for travel across the border without all the different problems that may arise if they are issued in a different language or any other things like that. It is something that is bottom-up collaboration, and I think that this will ensure that in the time when vaccinations will rise and the infections will go lower, that there will be room for travel. And well, if that is the case, and if all the legal considerations are done, then this would be the technical solution for a joint approach. Some other things, it's free of charge, so there is no costs involved. The digital green certificate does not preclude any other proofs. The member states who are receiving persons still have the opportunity, when the need arises, to have other restrictions. And that is something I think that's also, when you are going to travel, you would be likely to check if you go to a certain country what the rules are at that point in time, because it shifts all the time. So although you have like a certificate for a certain amount of time, you always should check whether this is valid in this country. But basically, that should not arise very often, because well, science changes, but the science changes for all people. So usually the same rules are applied. I think that's it for the moment.
Yeah.
Thank you.
Thank you very much, Vincent. Another great presentation. I like very much also the fact that you show how it kind of works in procedural steps. That's an important part, and I think that holds generally, so can also be used across the world. Hopefully everybody will have more or less the same steps. Nevertheless, with all this clarification, there are also still important questions that will remain, and we are here to discuss them in the next 20 minutes or so. I remind the audience, if you are seeing on your screen this workshop screen, there is a Q&A a thing that is called Q&A, and that's where you can pose questions. We actually did get a question in that I think is quite relevant here, and I want immediately to pose that to Konstantin. Konstantin, I quote the question is, do you think it's prudent for the member states to establish their own vaccination certificates, considering the new EU proposal? Perhaps isn't it better to wait for an EU-wide solution so that also interoperability, the exchange of data, is easier? Konstantin, what's your answer to this?
I think every member state is basically interested in seeing its own vaccination certificates or other certificates compatible with the rest of the other implementations in Europe or also globally. But still, I believe that it's important to start implementing already now, even before we have all the final detailed specifications, simply because most of the complexity is lying in the ways to collect data, to set up systems for issuing the vaccination certificate. So all that work would be still important and needed. And, changing some minor details of how the QR code is combined together, etc. It's less an effort, which could be done a bit later.
Yeah, so it's like a co-development. And in fact, also it will take a while before the European Commission and the EU has both the technology in place for the interoperability and also the legal proposal has been adopted, isn't it? I mean, can you remind us of the timing, roughly, the expected timing?
Well, the goal is to launch the system by June. So, but it depends on many questions, including, of course, the adoption of the legal proposal. And yeah, we are doing all the technical work already, as Vincent was already mentioning. Technical specifications are underway and trying to understand.
As you have heard, also the collaboration with the member states and the e-health network on the trust framework was already started and of course will continue. Ein, a question that I want to, first of all, you to answer, perhaps the others also want to add to that. You stressed very much this is to be a collaborative effort, and indeed, of course, there are more parties involved in this. If you talk about travel alone, than just governments. There's the travel and transport companies, for example. So what do you see as some of the challenges? I mean, they must be concerned about, can I handle all this? Is it going to cost me a lot of money? Who's going to pay? Am I going to still have the possibility to have my flights running in time? Tell us something about what you think can come up.
Yeah, thank you, Paul. Indeed. And that's the reason why we, with the Estonian government, have decided pretty much, as Konstantin suggested, to develop a service to start issuing Estonian citizens vaccination certificates, and then also the other certificates in April. So we are really on the final line of that, and then practice through the whole workflow with the ferry operators. They say that they have maybe 30 minutes to let through 1,500 people, so that they can go the other side of the Finnish Gulf. And there are many questions that they have right now, and I believe that it is important to start implementing, maybe in pilot stage. Still, as a public health professional, I would say we don't know what eventually the use of these certificates will be in autumn, when everybody is declaring that by the end of July, Europe will be has herd immunity. So, my kind of concern now is that we are putting extremely big effort to build a very sophisticated PKI-based system, and then in the end, we may little bit be with the same kind of situation as we have with the contact tracing apps, where we have the most secure privacy-preserving systems, but honestly, they do not add that much of a value to the epidemiologists. So that is why I still urge to consider that if we are doing something, let's make it valuable beyond just this summer, which I know everybody wants to travel. So I want to go as well immediately.
Yeah, it's also quite interesting. Like also Konstantin mentioned, we are building perhaps an infrastructure here that can stay for a longer while, going digital across borders in health, or reinforcing that, in fact. But still, this is also very much a national kind of thing. Perhaps I see that we have still Martin here. Martin, do you know, is there a need to introduce anything special in terms of legislation nationally in Estonia?
In Estonia, no. It will all work out. I think currently the epicenter of the problem is still global, because it's a basic thing how one government can trust the other government, basically. Yeah.
That is a theme. I mean, it's very good that you mentioned the word trust again, because that does and will continue to come back. And is also what I want to ask Vincent. I mean, Vincent, you talked about kind of like the need procedure when you are traveling and you get to an airport, you've got an agent checking and those kind of things. But lots of people are also talking about private use of the vaccine certificate. So what are some of the positives and the negatives about private use?
Well, yeah, I think that if you create any technology, so to speak, you will always have to take into account that this may be used for purposes that are not originally in the plan. However, we keep this in the back of our minds all the time, both the medical, the cross-border, and of course we also try to take into account the private use, which is of course not in our line of work now, but we also keep into account all the other societal aspects and the possible questions that may arise. So in this case, how these certificates are going to be used is the responsibility of the member states. So that's national legislation. Whether they will allow this is also another question. So it is up to the discretion of the member state to say, well, for instance, in the Netherlands, we have some field labs where we have just had a concert and a football match, and they just try to see what works. And that is basically what we're doing. We try to see what will work and how this will work out in a way that everybody will not go open up all the pubs and the restaurants willy-nilly. There is some regulation involved there as well, and those are, of course, are national regulations. If you're talking about the certificate, for instance, after you have received a negative test, you could use the same app, and there would be a venue where you would be allowed entry by just showing that app. And there's a good software that checks everything and does not show any information that is related to your health, but just says yes or no. Then that is something that could work, I think. But it has to be regulated within the countries, and of course we would like to think with them as well.
And for that, if I may continue, Vincent, on that point, I mean, there are quite a number of people that, of course, are worried about personal health data and data protection. Yeah. And that has got everything to do with trust. And now you can say, okay, that's all neat and clear when you are traveling and you see a border control. But the cases that you're talking about, like private use, could involve that someone has to actually show their ID and tell who they are and a photo, and then you also see some information about health, the person who is checking that. So isn't that a sensitive situation?
It is sensitive. It is sensitive. What we have come up with is the fact that, or is the solution where you don't know whether somebody has been vaccinated or had a negative test or has recovered from COVID after a positive test. And in that sense, it shields you from the actual medical data. It just says yes or no. And I don't know how far you can take this, but if you would not use this, then you would not be able to have a solution for these kind of things that people would like to go somewhere. And then, well, how do you check that? If you make like sort of a regulation for all the software that's checking these apps or paper versions, we should have in place the rule that the information that is in the QR code cannot be stored or reused. It's just for entry and that's it. And those kind of rules should be in the legislation, I think, because you could potentially, even if you have like a security guard at the venue, these security organizations, they reuse personal information for any purpose, and they're just selling it. It's part of the business model. So we have to make sure that this does not happen. Well, in that case, I would trust that this would work fine, and that privacy will be preserved. Yeah.
You say that should be national legislation, or at least the National Data Protection Authority.
It is about privacy and not about cross-border issues. So yeah,
okay,
yeah. You were. raising your hand.
Yes. I wanted to drop in another piece of experience that Estonia has gathered over the last close to 20 years.
Mm-hmm.
So I think one thing that smart and digital can do, and which you cannot do that well in the analog world, is that you don't need to put your trust only in one instance or one document. Distributed information management means that, and this comes also to the helps to understand that if we have concerns that this data will be misused, it is equally important to monitor and follow how the data has been used. It's the saying among cyber criminals that you don't do cybercrime in Estonia because you get caught. And that is one thing how you can balance the transparency with that of the efficiency and effectiveness of digital tools. So I think sometimes we try to protect the privacy, at the first instance, and then don't leverage its capabilities also kind of after the fact. So and that is why this Estonian proposal to the WHO, and Martin knows everything about it, is very powerful. That enables to build services, not just verify documents.
Okay.
We are, of course, are still under this is still under this. Oh, sorry, Paul.
Sorry, Vincent, in view of time, we don't have that much time, but please, short answer.
Very short answer, yes. I think in answer to your question, yes, we are also looking at all the different possibilities. We have rejected and accepted many during this process. So we're just still working on it. But I think on the track and trace, it has two sides. First of all, yes, you have like you can follow where the information went. But then the backside of that is, yes, you can follow where the information is gone. So that is in itself also something that is related to personal, to PII. So we have to weigh the pros and the cons in that sense, I think.
Thank you. Yeah. By the way, also, Aina, I would love to have asked you. You are doing this exercising. Are you also going to deal with quite complicated situations? People that are traveling around with vaccine certificates that perhaps are passing their validity because they have travel delays, or I don't know. I mean, I guess that I hope that all of you are thinking through also these complex situations. Is that true?
Yes, well, again, of course, we've tried to play through several scenarios, and that's also one thing that we have realized. We only know through the practice how the people will react to this, what are the workflows and all the other members within this ecosystem. So in that respect, I have full credit to the European Commission and the Health Network, because I know they have been working frantically. And so finding the balance of, okay, what is doable within a very short time frame. But at the same time, I still hope that people have in mind longer perspective. All this effort is only for these certificates to cross the border, and in autumn we really don't use them. Yeah. That's maybe a little bit wasted effort, whereas making people to be able to use their health data in other instances, that is a noble goal.
Great. We are getting towards the end of the panel. I mean, we're talking here about trust, and there are so many dimensions in it. We talked a little bit about the technical and the procedural and the safeguards from data protection point of view. We did not yet really talk about the cybersecurity dimension. I don't think we'll get to that. But in trust, always one of the most important things is definitely about communication. Communication, leadership, credibility, useful examples that people understand. So let me give to each of you the final word on what do you think is good communication around the vaccine certificates that can raise trust. What should happen? Just in a few words, what would you advise to do in the next few months? Ayn, I start with you. What is good communication?
Yeah, we're very brief. We're taking some time already. And we're also very practical. I think we need to really visualize what we're trying to do. Vincent did a very good job today here. So really having visual communication and taking time, giving people time to adjust to this and ask their questions. So it will be probably a process of 2 months at least before suspicious people gain trust in it. So take time, use simple visualizations, and that should work.
Okay, great. Vincent,
yeah, well, I think I completely agree with what Ein said. I think that if you have some simple but to the point information in a graphical form, then you can take out all the angles of people being mistrustful of what is in the QR code, what is this, and where are my data, and all these kind of things that we may expect, of course. And I think, so keep it simple. Stress the fact that this is good news because people can travel. I think that is already the first reaction of many people. They say, finally, I can go on a holiday, yippee. So yeah, why not? So let's stress that also, and not always go into the corner of the funny people, let's say, who are doubting everything, and try to regain that trust by being transparent. We have to be transparent. We have to be explaining this in a simple way. And we also have to make sure that this is not from Brussels. This is like a joint effort by all the member states. Yeah. And everybody agrees on this.
Thank you, Vincent. I think very wise words in that. Konstantin, of course, you are from Brussels, but still possibility to say now on the table. There's a lot of difficult.
It's more the framing, of course, yeah.
There's a lot of difficult work to happen. Something that you want to add on good communication around this? What would you say?
Well, many thanks to Ein and Vincent. Fully agree with their statements, and I believe we should also concentrate on refuting some existing myths. People saying that we are introducing new restrictions, which is totally not the case, or people saying that vaccination becomes mandatory, which is totally not the case. So maybe trying to better explain these very basic facts very clearly would be important. And of course, I cannot say too much clearly because that's a real challenge, and we should concentrate on maybe the positive messages, as Vincent was already suggesting.
Yeah, promote the positive and debunk the negatives.
So that's probably something that comes out, stressing the positive, be clear about what negative is and is not true, but also be honest and transparent about this. And I think also the previous panel ended on the note of that this is, of course, also a political process, and there's political leadership in this. Politicians can do really good job in being clear and in their communication in this way that we just described. I very much want to thank the panel. It's a pity that it is only less than an hour, and there are so many other issues that may have to be discussed when we talk about trust. This is not the end of the story. Again, grateful to the e-Governance Academy, and also grateful for their leadership to have brought this to the table so soon. So with that, thank you to the panelists. Thank you also to the organizers, Merle and Hannes. I hand back to the organization for the final conclusions. Thank you.
Paul Timmers, thank you very much. Thank you for really very eloquently sharing this panel on the vaccine certificate. I think I've become so much more wiser about what it is and what it isn't. And I hope that all of our viewers have as well. In an attempt to sort of capture the wisdom, I think we don't have enough time, but perhaps I would share 4 points that resonated with me in hope that they can be useful. First, information and data that is accessible and is of quality can provide us with tools to treat the diseases better. And that's relevant both for COVID as well as for all the other diseases. I think Terje Peetso really put it very eloquently, almost in a hashtag language. Hashtag data saves lives. Second point from Kalle Killer, who said that today we may not have clear user cases of data exchange, which is necessary for the vaccine certificate yet. Although I very much hope that, for example, the Estonian case that we heard today, Estonia planning to go ahead with the vaccine certificate in April, will be a success story. And I think this is a really good and brilliant example of the public-private partnership between Guardtime and the government of Estonia, which is so much needed in finding solutions to this crisis. Third point, I think what resonates from the last panel, it is about proper communication and collaboration on basis of trust in each other. And as a way to increase that communication, I think last point, we need to improve digital and health literacy of people. And I very much hope that this online conversation on digital health, data exchange, and the vaccine certificate has helped a little bit to increase all of our literacy in these issues. Stay tuned about more to come on our eGovernance Academy Digital Transformation Talks series. Check us out, follow us in Twitter, Facebook, and other social media. For those who would like to review some of the panels, we shall make them available for you both on our website, on our webpage, as well as on the social media channels. And thank you. Thank you all the viewers who stayed with us for these 2 hours, and have a great continuation of the week. Bye.